Let's take a wider look at our region. Reeves County, they are feeling the weight of the COVID surge. The rural hospital in Pecos has seen an influx in patients with COVID complications, straining staff and resources. Sounds familiar, right, to our hospitals in Midland, Odessa. What makes Reeves County's situation unique, though, is they're also providing medical care to hundreds of children and staff from the migrant holding facility in town. News West 9's Sammy Steele spoke with the CEO of the hospital today, and she takes the story from here.
Good evening, Tatum. Typically, Reeves County Hospital sees anywhere from 25 to 27 patients in the ER a day. Recently, that number, it has doubled. On Saturday, the hospital saw the most patients they had ever seen in a day, about 54, and 19 of those were children or staff from the migrant holding facility. If a pandemic and being short-staffed weren't hard enough, add a migrant holding facility into the mix.
I never thought I would go through a pandemic, and then on top of that, to have a camp that could house, I think right now the number I heard was a little over 1,100 kids, and several hundred staff members to take care of those kids. And so we're trying to help deal with any issues that they bring, to our facility.
But the migrants and staff going to the hospital aren't going for COVID reasons.
It's just, Sammy, a little bit of everything. We're seeing the children come in with different kind of immune system issues. A lot of these children maybe have not had a lot of health care in the past. So when they get here, they're maybe not best of condition. And so I know the staff out there, is tending to a lot of their needs, but they're having to send them in for like lab work to maybe check their blood to see how things are. We've had a lot of x-ray services. And then we've seen a lot of the staff come in for maybe some injuries, that happen maybe out there. They too, have some different health issues that maybe they've not always addressed.
McKinney tells us that just a few weeks ago, about 300 kids had chickenpox. The migrant facility is supplying vaccines for different diseases, including COVID-19. But it's the hospital that supplies additional care.
With the physicians and the nurses that they have there, they just called on us for some other needs, like some different medicines and things like that.
McKinney says managing the influx in patients has been tricky in Pecos because they're also short about 20 staff members.
So that in itself has been quite a challenge, especially when you're in rural communities. As I said, we just don't have a lot of the resources. And so, I currently, our facility is like probably 12 RNs short. That may not seem like a lot to a bigger facility, but to a small facility, that is a lot of staff that we're short. And so that means the little bit of staff we do have, they're just working, more than they ever have.
So what can people in Reeves County do? Well, the hospital tells me. So what can people in Reeves County do? Well, the hospital tells me if you need to go to the ER, to only go if it is an emergency. Otherwise, go to a primary physician or go to one of their clinics open on the weekdays. Tatum.